So you said you texted me and you had a patient. Tell me again what you texted me.
Yeah, so I had a patient. We had made it to day 4, and I'm going through. They acknowledged that they wanted to get to 100% normal as much as their body would allow through all 3 phases of healing. They wanted to get all 3 phases of healing back to normal. And so I began to, you know, based on where they were in the 6 to 12 weeks, I put them at a certain number. I multiplied it times the recommended schedule 3 times a week, and they said, "Wow, that's a lot of visits." And because I'm in a state of conscious competence, I'm still trying to learn this thing as I'm going. I never got that answer before. I didn't know what to do, so I just kept going. But in the
Well,
back of my mind, I'm like, I wish I had an answer for that.
well, actually you do. You just didn't you weren't you didn't realize it at the time, but when we actually expose the answer, you're going to see how ridiculously simple it was and you definitely knew it.
Okay.
So, if you had to think for just a second after I said that you already do know the answer to that. And remember, I told you what's the answer to like 99% of clinical questions from patients? That's a clinical question. What's the answer to 99% of patients' clinical questions?
Tell me, doc, because I forgot.
You can't, and no idea.
Yeah, no, no, it's not coming to me.
Well, Chris, your care is based on the science of the 3 phases healing with the repair, the remodel, and the repair, the inflammation, repair, and remodel relative to your test. Now, whether you choose to receive the care, that's up to you, Chris.
Okay.
Is that not the answer for 99% of the clinical questions?
Yeah, yeah, that makes sense. That makes perfect sense.
Isn't that the answer to his what he said?
Yeah, that would be the answer.
That's
Yep.
exactly the answer. It's up to him whether he chooses to do it or not, or to decide which phase of care he wants. So it's up to you what phases of care you want. But this is exactly how your body heals. And then how we know what therapies to do are based on your test that are positive. And that's how we know.
Nice.
So it's up to you to determine what you want. We just make it affordable.
Nice. Well said.
That's how it's done. Now, the only thing that I would say in response to that is, can you think of anything that, see, that's what would be nice if we had your day 1, 2, or 3 recordings. We could actually do a deeper dive, but we can't because you didn't do it. So it would be nice to see what you did or did not say to get him to that point of consciousness to ask that question. I'm almost betting there's something you missed out or could have done differently that would not have led him to come to that question. Because when you do it right, the the it's just common sense that it's going to take so many visits to affect whether it's the nerves or the collagen and the strength and the elasticity. When you do it right, it all just makes sense. The question is not whether it's the amount of visits. That's not the typical question when you're done explaining how the body heals and what you're going to do, how you're going to help it. That's not the question. The typical question is, can I afford it? And how much time does it take? Now, a side component to that, which is not the case from what I'm hearing now, is a trust issue. If the patient doesn't trust you, then they'll question pretty much a lot of what you say. But
Right.
based on anything you've told me up to this point, I don't know. And we don't have your recordings, so we can't find out. But that's what I would have liked to have done. I would have liked to going back to in the recordings and go, why did this even cross his mind? Because it's unusual once you explain how the body heals and it's third party and it's their choice.
Well, doc, I could tell you, I think when hindsight I look back, it probably was a trust issue because this patient, they question a lot of things they had like a million questions throughout the whole 4 days.
Well, that makes more sense that there was more of a trust issue than the content. Because that content is common sense when you deliver it in a simple manner, like we do. It's common sense that there's inflammation, you have to deal with the nerves. It's common sense that there's scar tissue. How many people do you know that don't know or have never heard of scar tissue?
Scar tissue?
Yeah.
That's pretty common. I think everybody's kind of heard
Right.
about that.
Yeah,
Yeah.
that's a ubiquitous word.
Yeah.
And then how many people you know have heard of the word strength
Everybody.
or mobility or elasticity?
Everybody. Pretty much
See, you
everybody.
get my point?
Yeah.
That there's like, I'm not, see, so when you ask me that question, I'm going, wait a minute. That it wasn't, the answer was simple, but that's not what I looked at. I didn't look at what was the answer. The answer is simple. Well, your care is based on the science of the 3 phases of healing relative to your test. It's up to you to determine what care you want. We just try to make it affordable. That answer is ubiquitous and simple for clinical questions. My first thought was, what did you do or say to make them say that? That's what my first thought was, because it was so unusual for somebody to say that when you delivered it in its simplistic form, like we teach. So now when we go to the trust issue, that's why I say now when you look at the trust issue, I'm going, well, then that makes sense. There's probably some trust issue there. And that's why there was them questioning it, because nobody, I mean, you can't question it. By the way, that's also why we make it third party. We don't make it chiropractic. Remember?
Yeah.
That's why we don't say it's chiropractic. That's why we say this is the way it is, no matter who you go to. That's the impression and the communication we want to deliver. And that's also why we hand them at the end of day 1 a copy from Google on wound healing with the inflammation phase. And on day 2, we hand them a copy of the repair phase. And on day 3, we hand them a copy of the remodel phase. And it's not changed. You don't alter it. It's a direct copy right from Google, because that supports exactly what you're saying, third party. Did you do that?
I did the first day. I didn't do the second and third day.
Okay. Well, I'd suggest in this scenario that you definitely do that for day 1, 2, and 3, because that's the purpose of it.
Right.
To show, that's why we say it's third party. Don't talk like it's chiropractic.
Right.
Because they can deny chiropractic. They can't deny the 3 phases of healing.
Right.
That's why. And that's why we give that out day 1, 2, and 3, because that's reinforcement to show this is how your body's going to heal, irregardless of me.
Right. That makes
And that's also why we don't change it, because I've had chiropractors say, well, what do you think about if I took that and I made it into a nice brochure for my office? And I said, hell no, you better not do that, because you're doing the exact opposite of why we're doing it. We don't want it to look like it's about you and chiropractic. We want them to see that this is the way the body heals, irregardless of you or chiropractic, to affect the trust. That's why we don't want it pretty and in a brochure. Does that make sense?
That makes total sense, Doc. And I see the value of it. I see the value of doing it all 3 days. Yeah.
The last question I would have is, what's the trustworthy source of the patient? So this was probably a cold call patient, not a referral, right?
Yeah. Cold call patient. Yep.
Okay. So you already, that's why I remember in the beginning, we're always trying to find out the source of the patient, because it tells us the degree of trust involved. So if it's a total cold call patient, what'd they do? Just Google you or what?
Yeah, they Googled me, called me. Yep, and they came in. And also, Doc, they were a specialist. So they were kind of like, you know how you kind of come in, you kind of like, I think I know exactly what it is, and this is what I need.
Well, before you go there, let me go back to, so it's a cold call. Did they have any type of discount? Did they come in?
No, there was no discount.
Okay, so there's no, and they were a cash patient, right?
They were, yeah, cash patient.
Okay,
Yep.
because the hardest, most difficult patient is the cold call patient with a coupon that's cash. That's the hardest, most difficult patient. So you had a cold call with cash, so you should have known that you had to do a lot more bonding and rapport, and even instituted a couple trust factors, which we can cover later. But that's why you need to know the degree of trust with the patient when you get started. Okay. But bottom line is, when you ask me that, I go, well, that's any clinical question. The answer is, well, your body's based on the 3 phases of healing. And the tests that are positive. That's what determines the therapy we do. And then we quantify that, we measure the reaction, if it's getting better, worse, or staying the same. And then we just try to make it affordable, and we try to respect your time. That's the answer to all clinical questions. And you get to make the choice. And then remember, I said, if a patient says anything else, like I always say, if they miss an appointment, then you can easily add into that. If you said this is your clinical answer, and I'll give you this answer, and then I'll give you the total package answer. But remember, I said if they miss appointments, the statement we always say is, well, it's up to you, Mary. The more patients you get in a shorter period of time, the quicker you feel better and you heal. The less treatment you get spread out over a longer period of time, it just takes longer to feel better. And sometimes it can end up healing wrong into a permanent injury, but it's your choice, whatever you want to do. So it's your choice. See, that's when they miss appointments.
Nice.
But if you really wanted to just to package the whole clinical answer, it's along those exact principles. That's the answer to everything. Every clinical question. So, Mary, your care is based on the science of the 3 phases healing, because that's how your body's going to heal. And then which tests were positive. And then we measure those tests. That's what determines what therapy we do. And because we measure it, we can tell if it's getting better, worse, or staying the same, or if it's going to end up with a permanent injury to some degree. And the more treatments you get in a shorter period of time, the quicker you feel better and heal. The less treatments you get spread over time, you don't respond as quickly, and sometimes it actually heals wrong. And then what we try to do is just make it affordable for you and our patients. And we try to respect your time to where you can get in and out of the office efficiently. Is that not the full answer to every clinical question?
Yeah, that's a phenomenal answer. That's
I would
great.
just memorize it. I'd write it down and memorize it.
I'm writing it down now, Doc, as we speak.
So anytime they say anything about a clinical question or missing appointments or whatever, that's it. I don't have to memorize 100 different answers, because that is what the care is based on, period.